in 2000. Well, we can speak now to senior scholar at the Johns Hopkins Centre for Health Security, as well as Public Health, Dr. Amish Adalja. Thank you very much for coming on the programme.
Thanks for having me.
What's your reaction to these latest recommendations?
I think that this just really further cements the fact that RFK Jr. has taken over completely our public health agencies in the United States, and they've become forum for anti-vaccine advocates to enact policy. And I think they've increasingly shown themselves to be irrelevant to the practice of medicine.
But they have not recommended that no one gets these shots. They have just said, why don't you just consult your provider? Is that such a big change?
It is, because it creates a barrier, because now it's not as if you can go to a pharmacy and get a shot. You have to think, did I talk to my doctor about this? Did my doctor say I should get this? It's just sowing doubt that there's a benefit to getting COVID-19 vaccination. Yes, it could have been much worse, and this might have been a compromised position, but it is something that is starting to erode the confidence people have in vaccines and erode the confidence they have in the process for how vaccine policy is set in the United States. And certainly they could have done worse things by requiring a prescription, but it is something that I think will lead to high-risk people not recognizing or being frustrated with the bureaucratic steps that are being enacted to get a vaccine when it doesn't need to be that way.
And so in very simple terms, your worry is that now that any barrier making it harder for people will mean a reduced number of people get it, and therefore that could have bad health outcomes for some of those people.
Exactly. What we wanted from the ACIP, what an ideal ACIP would have said is, if you are a high-risk person of any age, if you're a pregnant woman, if you're below the age of 2 years, you should be getting the COVID vaccine every year. For lower-risk people, there's room to argue there, and it's a marginal benefit in those situations. But they didn't do that. They basically said everybody should just talk to their doctor about getting it. And I think what we know in the United States is that high-risk people are still getting hospitalized and still dying from COVID. And they really need a directed message to them to stay up to date with the vaccine, because these are preventable hospitalizations and deaths that are occurring. And ACIP really failed. But they were designed to fail because of who is now on ACIP.
And forgive me, because this is quite a broad question, but vaccines generally around the world the science behind them is pretty settled, pretty safe. It's a pretty well-tested area of medicine. Why the scepticism amongst some people, and as you say, some people that are now in power?
I think it's because it's part of their political identity now. There are some people who have kind of been swayed by misinformation, disinformation, and have been convinced that there's no value to vaccines. They have the luxury of living in an era when, for the most part, a lot of vaccine-preventable diseases like measles are under control. So they think that there's no value, and they focus on bad studies, including those from Andrew Wakefield in the United Kingdom that came out linking the MMR vaccine to autism, and they don't actually recognize that these things have been debunked. They don't understand the scientific method. They double down, get involved in the anti-vaccine movement. It becomes part of their political identity. And then it's very hard to really get them to move on from that or to see the flaws in that argument. And what's happened now is what was a fringe movement has now been kind of given a lot of government power, with RFK Jr. running the Department of Health and Human Services. And a lot of the anti-vaccine sentiment is now been integrated with anti-COVID related issues that people were upset about, mask requirements and shutdowns and lockdowns that occurred. And now that's all one big movement that is very powerful and has been given a lot of power in terms of what RFK Jr. has been doing to the whole vaccine ecosystem in the United States. And I think we're going to pay for this.
Dr. Amish Adalja, thank you very much for coming on the programme. Thank you.
Thanks.
Around the world and across the UK, this is BBC.